Welcome back. Anyone can have back pain. In fact, it is the most common complaint in the United States.
I mean, how many people? Everybody says, my back hurts, my back hurts. Well, not only is it uncomfortable, it can also lead to lost work days and loss of money. And here to discuss low back pain is Dr. Rani Chovatiya with Pain Diagnostics Associates, an independent group of physicians who are dedicated to diagnosing and treating the pain. Great to see you.
Great seeing you again. Thanks for having me.
It is so common. I mean, I would think most adults at some point in their life are going to complain of back pain, and some people have it chronically.
Absolutely. I mean, the statistic is roughly 8 out of 10 Americans actually suffer from low back pain. It's more common than even neck pain or headache pain. So we see that a lot actually at our clinic, and there are many different reasons why someone may be suffering from back pain.
What's the difference between acute back pain and the chronic pain?
Well, acute pain is a normal response that the body will give you if you, for example, have some type of trauma, if you're maybe in a car accident or you kind of stub your toe. It's a normal sensation that your body feels and typically recovers, you know, within the time that it takes for the injury to heal. In the terms of chronic pain, that's when the pain is actually lasting for an abnormally long period of time, and it's persisting and it isn't going away, and oftentimes it can interfere with the patient's day-to-day living and, you know, lead to decreased productivity at work and increased irritability and decreased sleep, etc.
And that's more common.
And that's what we see a lot. And those are the kind of patients that we see at our clinic, and we basically try to get to the bottom of figuring out what the underlying cause is and offering an effective and early intervention.
Well, I think pain makes people crabby. You mentioned irritability, but honestly, and chronic pain can lead to depression too. So in your experience, what causes it, and what do people need to understand too about muscle-related back pain?
Yeah, you know, there are, like I mentioned, several causes of low back pain. It can be related to the spine and even causes outside the spine. What we deal with as being an interventional pain physician are issues related to the spine. So some of the main causes that we see for low back pain include muscle-related causes, bone-related, joint-related causes, nerve-related causes, and also the disc-related causes too. And so I'll just focus more on the muscle-related causes today since there's a lot of ground to cover. But yeah, there can be many reasons why the muscle can, you know, cause the back pain. We do see it commonly in elderly patients, but we also see it in a lot of young people too, such as athletes, for example, that are using those muscles a lot. The muscles that, you know, interact with the spine and that they're responsible for, you know, us moving our back, of flexing, of, you know, bending, twisting, and so, you know, those muscles are being used every day, you know, and just maintain our regular posture.
How much of a factor is obesity in a lot of the patients that you see, because that could just strain every part of your body?
Absolutely, and obesity is an epidemic in our country, and we're seeing it a lot more, and you know, many of my patients too. And what obesity does, it basically can create an uneven weight distribution on the spine and cause some muscles to possibly even stretch, other ones don't work as properly, so it can lead to poor posture, and then in turn can lead to back pain related issues.
Well, we mentioned that people get down oftentimes if they're experiencing chronic pain, especially if they've been treated and haven't had relief.
Sure.
So how do you help people? How does a consultation or a visit with you work?
Well, you know, we obviously want to meet with the patient. We ask them pertinent questions about their pain. So what we're concerned about is, you know, when the pain started, how it started, you know, what the intensity is, what it feels like, whether it's radiating elsewhere. We want to understand whether the cause is related to the spine or not. Because as I mentioned before, you know, back pain can be related to non-spine causes. We want to rule all those types of things out. And if a patient does notice that they're having back pain, you know, it's good that they either see a physician first, whether it's a pain specialist, and especially their primary care doctor even, in case it is something that's not related to the spine.
So when you are able to alleviate or help alleviate someone's pain a little bit,
right,
what type of feedback do you get? Do they come in crabby, like Molly said, and leave just jolly? Or
well, you know, sometimes it takes a little bit of time. It depends on the, you know, every patient is unique. It's unique in terms of how their pain symptoms present, and so, you know, that is my goal, and, you know, it really does make me feel good when I do see that. Oftentimes, you know, when we're able to figure out what the underlying cause is by talking to the patient, we get the appropriate diagnostic information, images, and by performing either procedures or, you know, implementing other types of therapies, we're able to see an improvement. And sometimes it's right away, sometimes over the course of maybe some time, but, you know, the patient is definitely grateful and able to kind of get back to their day routine, and that's, you know, It's priceless.
Well, and I think, that's the good news is you don't have to live with the pain.
No.
There is hope and there is healing. And I think that's good news for people especially who've had chronic pain in the back.
It's just a matter of kind of, picking up the phone and, setting up an appointment, seeing someone, and you shouldn't ignore the pain. I mean, the pain is the body's way of, it's a protective mechanism. It's a way of your body telling you that something isn't right, maybe there is something going on, and so you don't want to ignore it. You want to address it right away, so you can treat it right away, because sometimes by waiting and ignoring it, it could perpetually make the problem worse. And
do you find that people do that a lot?
Some do. I mean, sometimes people have been told, it's probably just in your head and just to deal with it or get over it, but it could be something that's actually legitimate. And by ignoring it and by not starting a treatment right away, it could possibly cause damage that can't be reversed.
And we ran out of time, but I think it's also important for people to understand chiropractic care, physical therapy, and the roles that plays, and get information about those as well.
Absolutely. And those are therapies that we try to incorporate in our practice, but it's also important to differentiate if there is a cause that's not related to the spine, that, they should see a physician first and to diagnose what the underlying cause is so they can start the correct therapy right away and not, delay.
All right,
Fantastic.
great information for a lot of people. Thank you for being with us. For more information on Spine Pain Diagnostic Associates, you can call 262-478-0301 or online at paindiagnostics.net. They are located on Port Washington Road in Mequon. Thanks again for being here.
Great to see you again.
Thank you. Thank you.